Hey y'all, and welcome to my channel. On this page, I talk about technology and money, and also sometimes trending news. If you're new here, you're welcome. I invite you to like the channel and also subscribe and share. Liking it, sharing does two things. It helps this information get out into the algorithm and reach more people, and then it also encourages me to continue creating new content. Also, welcome back to the returning subscribers, and also welcome to the new subscribers. I see the channel has picked up a couple of more subscribers here in the last week, so I appreciate everyone who follows and supports the content. And I also appreciate the donations via Cash App. I appreciate everything, even those who send in encouraging words and leave comments, because it does encourage me to keep going and continuing to find information that you all find interested, engaging, and helpful. Today, I wanted to talk about some very, not breaking news, but very recent news about artificial intelligence in healthcare, what's happening at the Mayo Clinic out in Minnesota, about artificial intelligence. Also, the president of the American Medical Association also just released a statement about artificial intelligence in healthcare and the impact to physician practices, doctor practices, and also what the Journal of Computer Informatics in Nursing also just released some very interesting call for papers around artificial intelligence. So I'm going to try to touch on all of this in under 30 minutes, but it's a lot happening in artificial intelligence, whether it's predictive AI or generative AI, and there is a difference between generative AI and predictive AI. There's a lot happening in healthcare, and it's happening very rapidly. Not only are physicians, but nursing practice, just different specialties within healthcare are having to adapt very quickly, or having to prepare to adapt very quickly. So I bring these stories to you all. You all may already be following a lot of this in general news and information, but I also bring it to this platform for those who may not be aware of everything that's happening, because there's so much happening so fast, rapidly around AI and its impact to healthcare and healthcare technology that sometimes it almost gets a little bit challenging to keep up with everything if you're trying to follow all the outlets. So that's why I talk about it. I also talk about it so that I'm a nurse who's worked in tech for over 20 years, but that doesn't mean, the experience that I have in technology operations that I can just rest on that. Or even the story that I did last week about how researchers have found that for those who are not nursing, who are not clinical, but who work in administrative roles within healthcare, in that story I did last week about people who do surgical scheduling, which is typically an administrative type task, and how new research is showing that AI is more efficient, more cost savings using the AI with a surgical scheduler than a surgical scheduler, an admin type person doing that type of work without the assistance of artificial intelligence. So our first story comes to us out of the Mayo Clinic, again, which is out in Minnesota. So this caught my attention just due to the volume of algorithms that Mayo Clinic has created. Now, I've been following what Mayo Clinic has been doing for the past year or two. They were the first health system that I heard about. Not saying they were the first, they were just the first that I heard about that were using generative AI to communicate with their patients and also embedding it within the electronic health record. There was also another health system I heard about out on the West Coast, out in California, that is doing the same thing. But what the Washington Post, and I'll share, because the Washington Post article is an opinion piece, it's a little bit long, I'll be sure to leave a link to it. You can read it for free by putting in your email address. I'll leave a link to it. But what caught me was that the Mayo Clinic has created over 160 AI algorithms 40 of which, so let's do 40 divided by 160. What's that percentage, y'all? My brain just got to know 40 divided by 160. So 25% of the algorithms that they have created are actually deployed and being used in patient care for specialties such as cardiology, that's for the heart, neurology, that's for like the brain and the nervous system, radiology, for those who aren't aware, like doing x-rays, CAT scans, MRIs, etc., and other specialties. And they have incorporated these algorithms in patient care. So they don't, beyond saying like the specialties, they don't say, if it's for physicians, they touch on it a little bit, or if it's for nursing or it's for administrative, but I'll breeze through this opinion piece from the Washington Post, and it says the AI revolution in healthcare is already here, that which we know. But for those who aren't familiar, the Mayo Clinic is a very large health system out in the Midwest, well known many years for being cutting edge and at the leading forefront of innovation, different types of innovation beyond just technology, but also in patient care and other areas adjacent to healthcare. So they are the largest integrated nonprofit medical practice in the world. Again, very well known AI, and it's really interesting that their president of the Mayo Clinic platform is John Halamka. And the reason why he's a physician who's also a medical informaticist, meaning he's a doctor who specializes in medical informatics or medical technology and things associated with informatics around physician care. And the reason why I say it's interesting, because John Halamka has had a personal blog, a personal website, I want to say at least since 2003 that I know of. I have been following his personal blog for almost 20 years. When I first started working in technology as a registered nurse, I think one of my coworkers told me about his blog, or I found out about it just happenstance. I think it could have been from one of our physician leaders who's also a physician who works in technology. But on his blog, John Halamka, because he used to be at a health system, I think it was up in Maine or somewhere up in New England, but he's always been one to talk about on his personal website just what's happening innovative wise in healthcare, in technology, coding, billing, things like that. He also has a farm. I don't know if he still has his farm up in New England, but he would also post on his website about the farm and off-grid living and things that he was just doing in his personal life around, like outside of technology. Very interesting. So anyway, he's now the president of the Mayo Clinic, their platform and what they're doing around using AI and deploying it for patient care. So he does talk about in this opinion piece the difference between predictive and generative AI. Basically, predictive AI just uses previous data to make suggestions or recommendations for your next steps, whereas generative AI looks at what's happening, like uses like text or images, like for example, out on the internet to generate like a conversation, right? So generative AI, you can ask a question, or you can say, generative AI, tell me a recipe, and this is what I have in my kitchen, and it will talk back to you like that, right? Versus predictive AI uses previous data and things like that. Okay, so they talk a little bit about how predictive AI is helpful to providers and people who provide care. Like for example, in this piece, they talk about type 2 diabetes and using AI instead of giving like generic recommendations for anyone with type 2 diabetes. A generic recommendation may be reduce the amount of sugar, don't drink as much alcohol, get exercise 30 minutes 5 times a week. The algorithm can predict the best care plan for the patient using demographic points such as their age, their ethnic background, any other medical conditions or nutritional habits, and much more. So, and they call out that this isn't new, that, there have been like individualized care for healthcare for patients, but it just makes it, using AI and predictive AI specifically makes it even more specialized in helping the physicians and nurses, et cetera, in their clinical decision making. And then also they talk about it in this piece, how it can augment diagnosis, specifically around like colon cancer, and being more accurate in improving the detection of those cancers. Very similar. It sounds very similar to what radiology physicians have been doing with AI and being more accurate in, like, for example, their breast cancer diagnosis, but then also using it more for than just radiology physicians, using it for other type of providers. And they talk a little bit about what Mayo is doing with generative AI, such as ChatGPT, in communicating with patients. And then saying, of course, it's not a one end all be all. You know, it has a lot of potential. It has a lot of potential that there's more work to be done, as well as some precautionary things around like existing biases. You know, we've talked about here before, and other platforms have talked about how some programmers and prompt engineers can inadvertently or advertently code their biases into the algorithm. So it's not perfect, right? But there is some promise. So it's just really interesting that this article came out just yesterday about how the AI revolution in healthcare is already here. Pretty much what we already knew, okay? So the next thing we're going to touch on around it, because there's so much happening. This is another a piece that came out in Politico. Becker's reported out on it. I picked it up on Becker's, but it's also originated at Politico, where the president of the American Medical Association, their chief head, right? So the American Medical Association is considered by many to be like the gold standard, the blue chip, like the top of, you know, if the AMA says stop smoking, that is a very significant thing. And so that's just an example. So for the American Medical Association's chief to come out and say, quote, physicians who use AI will replace those who don't, end quote, is very significant, and just lets you know how rapidly evolving AI is, and how pervasive it is. Okay. So they do go, let me pull up, here we go. Pull up the political piece. So he says it will not replace doctors, but those physicians who don't use it could potentially be replaced, right? And so the president or the chief, the president of the AMA, or the chief, is a physician who does have a specialty, again, in informatics and also in digital health. I just thought it was, again, this is a relatively long article, so I won't read it line for line. I'll just be sure to leave a link. But I just think it's really interesting and something we should pay attention to. I work in healthcare technology, but even if you don't work in healthcare, I recommend to you to just do an internet search to see what is happening in your specialty and how AI is being used to enhance and or potentially replace those type of tasks that are pervasive in your specialty, whether you work in banking. I think I did an article, I did a live about a week or two about how AI, how people who work in finance are now starting to talk about how AI is starting to become more pervasive in their world, or people who work in supply chain logistics, transportation, the hotel industry, right? Things like that. So I encourage you to see what's happening in your profession. And if you're not a part of a professional organization, if your specialty, no matter where it is, what it is, if it has a professional organization, I encourage you, if you don't want to join, at least follow their website or their social media feeds. Because, like, for example, I'm a nurse. I try to stay informed what the professional organizations for my specialty and broader are talking about, because that lets me know what is coming or what is here and how that's going to impact my practice and how I do work. And the last thing I wanted to talk about around just the rapidly how AI is becoming so pervasive so quickly, and how not only the American Medical Association now has put out a statement about it, also computers, informatics, and nursing. So I want to talk really briefly about this. So computers, informatics, and nursing, it is a journal. It has been around at least since like the 80s or so. But it has been considered, just like the AMA, one of the gold standards in blue chip. When I say blue chip, I mean like high quality source to get information about nursing and informatics and computers and nursing and technology, nursing practice and how it's impacted in technology. And so this journal just released a call for papers, right? So this journal has been around a long time, very much in demand, but they just released a manuscript just this week, within like the last day or two. Computers, Informatics, and Nursing, this journal, this very highly well-regarded journal, is going to be doing a special edition on artificial intelligence in nursing care areas. So not just like for nurses like me who work in technology, but AI in all nursing care, right? They want to do a special edition, and they're doing a call for papers for anyone, for nurses for people who are doing like new research, doing case studies on AI in nursing practice, clinical reviews, professional development. So like all of my nurses who work in clinical education and professional development, that's a very important specialty within nursing, right? What if they're doing anything around AI, because they're wanting to, this journal is wanting to like provide a resource to nursing in all specialties about the management of AI, and its impact to nursing practice, also by spreading the information. This is really interesting. They said their goals are to develop an awareness of AI use in healthcare and implications on nursing care, which, is ultimately patient care delivery, explore tactics used to leverage AI in nursing care, such as virtual reality. I know of some professional development, clinical education nurses who are using virtual reality, for example, to train new nurses, right? Voice assisted technology, NLP or natural language processing, rules-based system, machine learning, image recognition, robotics. I know there's quite a few things happening around robotics and nursing care delivery. There's that big health system down in Florida that is using robots to help assist with the nursing shortage. It's like they're using them almost as nursing assistants. The goal of this special edition is to recognize how AI is changing the nurse's role in patient care delivery. Y'all, it really is, whether or not your hospital or health system, or if you work in a physician office, even if they have not adopted or piloting out AI embedded technology tools, just know that there's a high potential for it to come, and you have to think about how you're going to upskill yourself, no matter where you are practicing. I talk about it here. I know other people talk about it on their pages as well as on LinkedIn. So, unless you're getting close to retirement, at some point, I have a feeling that most specialties within nursing, even if you're in aesthetics, right, will be impacted by AI and just different tools in the way care is delivered. And then the last goal, they want to understand challenges facing the nursing profession as AI is integrated into healthcare delivery. Y'all, so the call for manuscripts is this mid-October of this year, and then the special edition is expected to be published next spring. A lot happening, y'all. A lot happening. And if you don't know, I also did find this other journal. If you're the type of person who likes to stay informed of like peer-reviewed journals, the Computers, Informatics, and Nursing Journal did have a piece in the newest version of the journal that was released this month, titled The Disruptive Impacts of Next Generation Generative Artificial Intelligence. Y'all, it's so much happening, right? And I think it's important to not be afraid of what's happening, but being sure that we are preparing ourselves, we're preparing our children, if we have children, no matter what type of work they want to do, even if they want to go into arts, right? or creative worlds. There are many creative jobs that are being impacted by AI, right? Screenwriters and things like that. Just making sure that we're prepared and we're ready career-wise, or creating our own jobs around it. That's it, y'all. Thank y'all so much for all, again, to everyone who like and share the videos, and welcome again to the new subscribers. What do y'all think? I'd love to hear from you. Okay, y'all. I'll see you in the next video.